Well, welcome to Focus Today. I'm your host, Perry Atkinson, and got a special guest in the studio today, and maybe an opportunity for you. I am delighted to have with us today Katie Adkison. No, not Atkinson, but Adkison, A-D-A-T.
Yeah.
And she's the director of the Asante Hospice, and we want to learn from her and maybe inspire you to prayerfully consider being a part of what she does. So thanks for coming in, Katie.
Thank you for having me.
And tell us about hospice and how that helps families and patients and what you do.
Okay. Well, hospice is a program that's for terminally ill individuals, folks that have a prognosis of 6 months or less and maybe struggling at home, trying to figure out the end of their life, what to do next, yes. And hospice comes in. We're a multidisciplinary group, a team that work together to help provide comfort and quality of life at end of life.
Well, I got to tell you, I have had firsthand experience with hospice, and you folks do a wonderful service, just a wonderful service. And so when is the right time to have hospice come in?
Well, really, the sooner the better. If your physician has told you that you have a life-limiting illness and you're struggling with either symptom management or pain that's out of control or anxiety, things like that, or just fatigue. Oftentimes the caregivers or family members who are providing the care are tired and need additional guidance. And the goal truly is to stay in the home and really have that comfort and have the team come around you and help support you in your home.
Well, I have seen, like I said, I've experienced the volunteers and the workers, and again, provide just an incredible service. And how does somebody qualify to work with you and maybe become involved and become a hospice provider?
Well, as a hospice provider, as a clinician, we have registered nurses and medical social workers, chaplains, and a medical director. That's the core team that helps to provide the care. And then we have a large group of volunteers that apply to become hospice volunteers. They go through a 6 to 8 week training. And part of that training is really just defining, is this what I want to do? A lot of it is self-awareness, and is this something in my life that I can do now to come alongside someone who is dying and family members.
It's a difficult time, I realize that, but it's also an incredible time to really help people.
Absolutely.
And help families. And is there, and you say the training is how long?
So, anywhere from 6 to 8 weeks to really, again, you as a volunteer, you'll learn about what hospice is, what the regulatory things are around hospice care, but then about active listening and just being present with an individual that may be dying.
Now, you're obviously trained also how to work with the medical teams. And,
oh, absolutely.
And that's all part of it.
That's all part of the training.
It is it? Okay. What is, I know you use music.
Oh, yes.
Tell us about that.
Okay. Music, we use all different kinds of music. Truly, it depends on the individual and the type of music that they like. But we do have a couple of music thanatologists. Now, thanatology is the study of dying, and music, obviously, is music. And they use harps. And they match the breathing patterns with the individual that's dying. It's a form of relaxation for the patients and the caregivers or family members. And it's just incredible. Sometimes we have these folks come into the home, and it's one of the best things that they've had.
Well, you know, past experience also, I know that hospice not only obviously helps the patient, but the family.
Absolutely.
I think you probably do almost a greater service to the family.
Absolutely, absolutely. We certainly we teach the family members from the medical component how to provide that physical care, how to recognize symptoms, how to use the medications appropriately to alleviate those symptoms. But also we provide, as the team, we provide that support, truly, to have somebody to talk to, and really who knows what you're going through, who can acknowledge what's happening.
That's wonderful. All right, now, not everybody's called to do this, and not everybody's drawn to this, but there are those. I mean, I know from being on the ministry side, I've come in and out of hospital situations and homes, and I know that from a ministerial standpoint, the visits can be short or lengthy, but they're not the hospice giver. They're not the hospice caregiver.
Correct.
But they are part of the team.
They definitely are part of the team. As a volunteer, as a hospice volunteer, you can, it's a wide range of things, from errands to yard work to sitting with the person that's dying, providing respite for the family member, even just respite for the family member to take a nap.
Yeah.
Just to be present.
Boy, that's so important. And I, again, validate 1,000% what you provide, because I've been very close. Now, there at Asante, what are your needs? You need people. We
do. We need volunteers to provide this respite. We also have a new program called Transitions, and that's a pre-hospice program where we're also utilizing volunteers for that. And that's a medical component where the physicians provide referrals to kind of fill that stopgap before someone's eligible for hospice. Maybe they're still receiving treatment, but they still need that type of support in the home.
Okay, how long is this training?
How long is the same?
The same, okay. All right, so what do? They get a hold of you? How do they do that?
So volunteers, if you're interested in becoming a hospice volunteer, what you would do is you would contact Sally Melton. She is our volunteer coordinator. Okay. And there's an application process. She interviews every volunteer, and then the classes start. We have a program that's coming up, and I think actually that class is full, and then we have another training that's happening in the winter at the end of January.
Okay. And how long is the course?
6 to 8 weeks.
There you go.
Yeah.
Well, I think it's a wonderful opportunity, and if you feel called and led to investigate this, I really think you ought to check it out, because it's a service that is just tremendous, and something that will be with you forever. And being involved in this, because I have witness firsthand what you do, and you know, so often you just give the family a rest.
Right.
You know, it is very stressful.
It is extremely stressful, and oftentimes the families really feel like they're alone. They get some guidance from their physicians, but they truly are alone in their home. They may have their family and their extended friends and family, but someone to come alongside and really support and understand what's physically happening to the body, but then also emotionally and spiritually to help support that family.
All right, now pain management is certainly a part of all of this, because you certainly don't want to see anybody suffering, and I think that's a big part of what happens here.
Right. Many different diseases, whether it's a cancer diagnosis. Oftentimes we see a lot of pain with cancer diagnosis, but then the end-stage chronic illnesses, there's a lot of pain that comes along with those end-stage chronic illnesses. We can come in, our nurses are trained, probably 40 to 60% of our nurses are certified in palliative care, so they've had additional training to know how to manage symptoms, use the medications appropriately to ensure that, one, the patient is comfortable, but then not over-sedated or struggling.
Well, Katie, this is wonderful. What do people do if they feel, led to investigate this and maybe get involved? What should they do?
Well, from the patient side, they certainly have a conversation with their physician. The physician can contact us for even just an evaluation. If maybe somebody is not quite ready, we can come out and make a presentation, talk about what they're eligible for, and then help to support them in making that decision. And
those who want to get trained in the program, same thing?
Contact Sally Melton. She's our volunteer coordinator, and I believe on our website there is an application as well.
There is. Well, I want to thank you for what you do. I have experienced firsthand your services, and I just think that a tremendous resource to family and to help during these critical days. But the main thing is not only being trained and knowing what to do, but you want to make sure that there's no suffering going on, and you folks do a wonderful job with it.
Absolutely.
And you're trained to know when there is pain and there isn't and all that.
Correct. And we help the families too to recognize that.
Good. Thanks for coming in.
Thank you for having me.
Katie Atkinson, excuse me, with us today, and she is the director there at Asante Hospice. So you may want to get a hold of them. What's the number there, by the way?
Our phone number is 541-789 5005.
5005. Give them a call. Maybe investigate the program. Thanks, Katie, for coming in.
Thank you. Thank you for having me.
We'll be right back.